when you hear those words, it just brings in all of these questions that you need answered, and you can't really get the questions out fast enough. And then it was my dad who told me, so there was a couple moments where there were questions answers I had formed in my head that weren't even necessarily right, which kind of freaked me out even more. Like that kind of thing, just from what I knew cancer happened. And then it took a while to sink in. It took a really long time to actually digest the fact that I had cancer. You know, I would sit in the mirror and just say, you have cancer, because I'm like, I don't feel like I have cancer. I can remember exactly down to like the room I was in. I remember so I was diagnosed in the children's floor, and so they came in and took my parents out of the room to tell them something. And I'm 15, so I know something's not going on that's good. And but that's how they do it in the pediatric floor, because the parents are crying, they have to make decisions, that kind of stuff. They don't want the child to see that. And my dad came back because my grandmother actually had CML, so he had kind of went through all of this with his mom, and she was diagnosed at the same hospital and everything like that. And so dad was like, I can't leave her in there, like I can't be in this room anymore. And he came back, and he's the one who told me that I had cancer. And it was an emotional moment, to say the least. Your life changes in a split second. I know it sounds really cliche, but there's no other way to describe it. You don't know, how, for lack of better words, how much longer you have necessarily until you hear all the facts. You don't know what it means. You only know what you hear, that kind of stuff. So there's like a slew of things going through your head. And some things that you would never even think that would go through your head too in those couple minutes. But yeah, it was emotional, something I'll never forget kind of thing. There's not really words to describe it. You just run your hands through your hair and you come out with chunks of hair, and it was really hard, especially at 15 years old, when you're thinking about high school and 15 and boys and everything else. And yeah, that was I wouldn't say that's a big setback, because it like happens, but it was probably the hardest thing that I had to do through treatment, for sure. I had, to miss, I didn't get to cheer again until my junior year of high school. And that was due also because of like chemo, but I developed a blood clot due to one of the medications, and I hate needles, and I had to inject a blood thinner into my stomach twice a day for like 5 or 6 months. And when you're on a blood thinner, you don't want to risk any kind of cuts, bleeds, that kind of stuff. So they wouldn't let me cheer. I was involved in the sport, in the team, and always went to the games that I could and things like that. But that was a really hard setback, especially at 15 years old, whenever you should be able to do what you want, that kind of thing. So I went through 2.5 years of chemotherapy treatment at the University of Virginia Medical Center. And I reached my 5-year out of treatment remission milestone in May of 2019. So when you're in remission, you wait 5 years until you're considered a quote unquote like survivor, because when you get to that 5-year mark, they think that you're cured. Usually your cancer isn't going to come back, and if it does, it's a different type of cancer. So everyone like really strives for that 5-year mark. So I just reached mine this year. I do have a fear of needles, and that is why I'm not in nursing school. Because a lot of people will go through treatment and they'll go back and be nurses. And actually the person who gave me my first ever chemo treatment was a nurse who herself had ALL. And so, you know, seeing her like in her 20s, she was telling us about her kids and everything, and then was telling me about like her treatment and everything, was an eye-opener. You know, it made me feel like, okay, I can do this. Like, you know, like you're scared, like you don't feel like it's ever gonna end, and then you're seeing someone who went through exactly what you did, and they seem like they're normal, you know, like, and they're living their life now. And so that had an influence on it. But then my doctor was really, he's an awesome man. He's an amazing doctor. And he was really good about telling me, okay, well, we're gonna give you this medication. And I was like, well, why? Like, it was like Benadryl for anti-nausea, and I was like, that doesn't seem weird, or so that kind of seems weird. And so he would be like, oh no, we're giving it to you because it relaxes your muscles in your stomach, and so it makes you like less nauseous, that kind of thing. I'm like, that's really cool. And so that sparked my interest in pharmacy. But I always knew deep down that I didn't want to just be a retail pharmacist, that I wanted to work with doctors to help them determine like the best treatment regimens for patients fighting cancer. And it took me a little while to even realize that was an option in pharmacy. So finding that at WVU through clinical pharmacy has been, it just makes everything kind of feel like it makes sense, if that makes sense. I cannot even begin to describe how amazing my community was whenever I was diagnosed. There were a couple other people, a couple other kids around the time whenever I was diagnosed that were also diagnosed from my area. So having that family connection there was really awesome. But the relay team at my mom's work came together and did some fundraisers for me, and you know, just having people put on my Facebook, oh, we're praying for you, things like that, made all the difference in the end. And they might not even know that it made a difference, but it really did. I don't know if I ever thought about my health afterwards, because obviously there's a lot of late-term effects that can happen because of chemotherapy that we're exploring into now a little bit. I was always just getting to that finish line though. Like, it's a very new world to be a cancer survivor now instead of a cancer fighter, because it's also not what I expected it to be. But I did have, you know, like being in the hospital beds, what I always thought about was, okay, we just got to get through this, and then one day you're going to get to help patients. Like, you're going to be on the other side of this, and it's all going to make sense, and it's all going to be worth it. And I've always said, you know, if I can inspire one patient or one person to like finish their journey with maybe a little, like a happy journey, and maybe see it as something that they grew from or something like that, it's all worth it. That's how I feel about it.